Hello, Elevate Atlanta. Thank you for having me. I'm Brooke McKeever. I'm excited to spark an interest for you in photobiomodulation by LightMD and UltraRed. LightMD is advanced photobiomodulation. It's medical grade. We offer a professional grade product that is hospital grade materials, medical grade silicone, which is non toxic, aseptic, non porous polymer, doesn't harbor bacteria. We are not pharma. It's convenient and comfortable. And as you can see, we're super certified from the FDA to ISO, IEC, and even the FCC, GMP certified factory as well. LightMD's pro medical applications include pain, infection, immune response, inflammation, injury, and dysfunction. As you can see, there are many therapeutic benefits of LightMD's PBM, and we have the world's most versatile system. This is certified to improve circulation, reduce inflammation, and speed up the natural healing process for injury and illness and disease. You can see a little bit about our system here with the reconfigurable pads. You can place them all over the body. They're also bendable. This is important so that they hug and contour the body and the curves of the body so that you get the maximum absorption of light. We also have a large amount of LEDs, over 1,200. So that covers a large area, over 1,200 centimeters squared. This is important. Light in these light pads offer a full spectrum of wavelengths from near infrared to red, green, blue, and violet, with the near infrared and red offering mitochondrial and cytochrome C oxidation activation, ATP generation, improving metabolism, healing, immune boost, and pain. So the definition of photobiomodulation is using photons of energy on living beings to modulate the process of improving metabolism and gene expression. So both the red and the infrared come standard with this machine, and that's what they do. In addition, the different wavelengths, including green, do fat burning, which is triglyceride release, but it's also excellent for stem cell activation. We have in vivo and in vitro just case studies on this if anybody is interested. The blue and violet light are good for antibacterial infections, antiviral, antifungal, and the violet is also good for skin irritations like psoriasis and eczema. The unique advantages of ABP, which is the parent company of LightMD, include efficient energy coupling, showing the contouring of the light pads to the body to get the maximum deep tissue penetration, treating a large area in one setting with two outputs, showing that you can treat concurrently two areas of the body or two patients at the same time. We also have advanced technology for tissue specific therapy, and this is with the pulsed system. We range from 1 to 20,000 hertz, and most of our protocols involve 1 to 10,000 hertz. It is medical grade and hospital accepted. We are in hospitals in Taiwan where a lot of our studies came out, including one that came out this week for post op knee surgery replacement. And we're super excited, so we can share that with you now. We also have an extensive patent portfolio, international and IP. As I mentioned with the energy couple, the greater amount of the distance between the skin, the more optical power is lost. So basically, 2.5 centimeter loses 93% of the energy. This is huge. So as you know, like the panels that are really popular and wands, they're bouncing and reflecting off of the skin, which isn't going to get the maximum absorption that you need for the photochemical process to happen. This is super important, and this is kind of getting lost in translation for all these devices. So, as the properties of light are reflection and refraction, absorption, we need the absorption. You can see LightMD's light pads being configured in different ways here, from 2 pads to 3 pads on different parts of the body, including a neck pad, which is great for a cervical collar, but it's also used as a headband for the brain treatments that we'll go through, and also under the chin for the brain treatments, as well as for beauty sessions. The best part of LightMD is that we do these things: deliver the right wavelength, which is the color of the photons, deliver the right energy dose, which is the fluid, deliver the right power uniformly to the treated tissue or organ, and deliver the right pulse modulation frequency. Over 25 years of case studies and research has gone into this since our inception, and we have figured out a way to maximize results in the most shortest amount of time. And so it's really pretty incredible to see this. As my ultra red clinic, I witness this daily. How does deep tissue PBM affect internal organs? Well, you have the source of the light, which is the LEDs. You have your mitochondria, which are in every cell except for red blood cells. The mitochondria absorb the light. Mitochondria then release the biochemicals ATP, nitric oxide, reactive oxygen species, and nuclear transcription factors. These biochemicals control the tissues, nerve tissues, smooth muscle. Now, those tissues control organ function. This is how we are getting that deep tissue penetration. Plus, um, I just think that personally that the light goes deeper than we think. So this is what we can prove, and it's just up for more research as well. And we're excited to be a part of this. Now, there's substantial evidence of deep tissue PBM. We've got case studies with our parent company, Light ABP, and then we have Light Doctor as well with the hospital case studies, research, physician testimonies, patient testimonials. We have a small animal clinic in Cupertino, and equine light therapy up in, which is treating the horses and large animals, and Light, which is horses and camels. We also have publications from COVID to now knee replacement, beauty, and also back pain. The LightMD and UltraRed therapeutics and case studies are next. We have tons of on-label medical cases, off-label medical cases, and non-medical conditions. These lists are minimal in compared to what we have seen. So more on this off-label that's interesting me right now is mold illness and mast cell activation. It seems to be prevalent right now, and so those are pretty interesting. We are having incredible results, and the physicians are all paying attention to this with our clients with these conditions. Today's cognitive health challenge is that few modalities treat brain neuropathies. Surgery and drugs are not always viable options. This is where LightMD's PBM systems offer the best non-invasive, non-toxic solution for safe and effective therapy. And you have neuropathic cognitive impairment is a pervasive and growing public health crisis, such as Alzheimer's and dementia, CTE, brain fog and inflammation. I don't know what happened there. Common brain neurologies, etiologies, traumatic brain injuries from accidents in sports, prevalence also in children and seniors, as are strokes, drug toxicities and overdoses, also age-related neurodegenerative diseases. So LightMD is a good option for this. This slide shows how the pads can fit all over the head. So all regions of the brain can be covered, and that's important, including the chin strap under here to get deep into the brain, pituitary and pineal. Here are some case studies. I'm going to whip through these, but basically case with Parkinson's improving after just one session, so much so that living in a rural area, she ended up purchasing the system and has had incredible improvement from her symptoms, but also slowing down the progression of the disease. We have Alzheimer's case studies as well as PSP, which is incredibly interesting because there are no solutions to that, according to a neurologist that we work with. This man was given 6 to 8 months to live, and after doing light for 3 times a week, his wife said she had her husband back. This is incredible. He was even golfing, and after a year, he is still golfing. It's been 2.5 years, and he is still with us. Showing depressive syndrome. This is one of our studies that's ongoing. We have an increased area of oxygenation after transcranial PBM. Also, the mood increasing and transhemispheric connectivity with the nerves. So this is showing the increase in neuroplasticity. I've got to wrap this up. I'm sorry I'm speeding through it, but we also have case studies on the viral, bacterial, and fungal with COVID, deep tissue examples. We have case studies with endometriosis, menstrual, parasympathetic, pituitary, vagus nerve, anxiety, panic, stress, hormones. This can all be balanced. Homeostasis can be achieved with light. And our systems, we have quite a large portfolio here with multiple pro systems for any indicated use. So please reach out. Happy to share more. Whipping through this so I can honor the time, and I'm grateful to be here. But we do excel at both pain management and neurological therapy, as well as transcranial PBM. If anybody wants to reach out, it's Brooke M at lightmd.com. Ultra Red Light. Thank you for being here. Have a good one.